Dracunculiasis, also known as Guinea worm disease, is a parasitic infection caused by a somatic nematode called Dracunculus medinensis. It is one of the few parasitic diseases that is very close to complete global eradication. The disease was first commonly reported from regions along the Gulf of Guinea in Africa, hence the name Guinea worm disease. Dracunculus is a long, thread-like worm. Female is much larger than male. Male is only a few centimeters long. The life cycle of Dracunculus medinensis involves two hosts. The definitive host is man and the intermediate host is cyclops. Cyclops are the microscopic crustaceans. Man acquires this infection by drinking water from stagnant pools containing infected cyclops. The cyclops carries the infective stage of the parasite, that is L3 larva. Inside the stomach, cyclops die and L3 larvae are released. These larvae penetrate the small intestinal wall and migrate to thoracic muscles. They mature into adult worms. Male and female worms mate. After mating, the male worm dies. The female worm migrates to the skin, most commonly over the ankle, feet and legs. A local painful blister develops. The blister eventually ruptures, releasing large number of L1 larvae into the water. These infect the cyclops and molt twice to form L3 larvae, which is the infective form. Moving on to the clinical features, a painful blister is seen usually on the foot, ankle or lower leg. This blister causes intense burning pain. Patient may also develop fever, nausea, vomiting, weakness and itching. The blister ruptures and the adult worm slowly emerges through the skin. This is the most characteristic feature of the disease. If not managed properly, this can lead to secondary bacterial infection, cellulitis, abscess formation, joint involvement, disability, etc., affecting the quality of life. The classical diagnosis is the observation of an adult female worm emerging from the skin blister. A history of drinking untreated water from stagnant pools supports the diagnosis. As a part of treatment, the worm is wound around a small stick and is gently and slowly extracted a few centimeters each day over 15 to 20 days. Pulling too hard breaks the worm and worsens inflammation. Prevention plays a vital role. One should drink safe filtered water from protected water sources. Cyclops population in water sources must be reduced. And that wraps up a high-yield overview of Dracunculiasis.